Hello, everyone, and welcome to Candid Conversations. I'm Sandra Seapack. We are very excited about today's show, Taking Charge of Your Health. As women, we tend to be so busy working and caring for everyone else in our lives, we often don't put ourselves first when it comes to being healthy. But it's really important to recognize making a commitment to taking care of yourself and your well-being should always be a priority. Getting regular exams, eating right, and staying physically fit all have a positive impact on feeling good and keeping you in the best of health. Today we'll explore how we can all improve on living a healthier life and also discuss some very important women's issues such as breast cancer and the treatments that are making a difference. Our guests today are Dr. Shamsa Mercy, an OBGYN and fertility specialist here in Santa Monica, and also her sister, Dr. Farina Mercy, breast surgical oncologist. Before we meet our guests today, I'd like to introduce my co-hosts, Dina Diamond and Becky Lantry. Welcome, ladies.
Hello, hello.
Today we're going to talk about women's health.
I know, and I'm really happy we're talking about that. You always hear nothing's more important than your health.
Right.
It's so true, but a lot of people don't think about that. For 5 years, my career was that of a professional patient. I mean, I was in and out of the hospital, in and out of the emergency room. I mean, it was ridiculous. I was in and out so many times. I had so many hands inside me. I felt like a Muppet. It was ridiculous. But you never realize how important health is until you have a health scare like that. And as women, like you said, we don't put our health first, and we need to.
Right.
I mean, so what do you guys do to make sure that you take care of yourself first?
You try to take care of yourself first, but it takes something happening to you to make you acknowledge that you should have been first all along. So it's like that.
You have to make it, as I mentioned, you have to make it a priority. It's so vital to do that. You can't let it go. Don't wait till there's a problem to go to the doctor.
But it's not easy.
But it isn't, I know.
If you're
That's
doing
true.
50 million things, it's never
Right.
easy to stop and say, okay, it's time to see about me. It just never happens.
Well, there's never a good time to be sick, and there's never a time to, that you want to go to the doctor. But I think we really need to pay attention to that, especially as we get older. I think it's really vital that, we do that.
As we go through it, depending on whatever age it is.
Right.
It seems like when we're younger, before we start a family, before we get married, we do make time for ourselves.
Right.
If we have time to do our nails and time to take care of waxing, hello, I think we can find time to get our big jiggly butt to the gym, don't you think?
Definitely.
And take the time to make sure that we prepare healthier foods and we do what we need to do to take care of ourselves.
And I think it's good, and we're going to talk about that in today's show. I think how we can, make the priority for exams and tests and things that should be done on a regular basis. Don't put it off. Don't let it slide. Don't let it go by the wayside. It is important to put yourself first, and I think when you do that, then you can take care of everyone else so much better. I think you're in a better place to do that.
You have to make adjustments.
You do.
It's a must.
And they have to understand, they're going to have to understand that mom needs a break. I have to go to the doctor. I have to take care of myself before I can take care of you. I think that's really crucial that we do that.
Yes.
And that's why
And I think it's good that you share that with us. Being a professional patient, that's not an easy thing to do.
it really isn't. And you would think after 5 years you'd get a wing named after yourself, but it doesn't happen. It didn't happen, but I can always try again.
Did they offer?
No, but I'm going to work on that next time.
That's okay. That's okay. Well, we're going to take a break, and we're going to be right back with our very first guest on the show talking about women's health, Dr. Shamsa Mercy. So stay right with us.
Hey! I don't know you.
Some problems are just too big to ignore. But don't take matters into your own hands. With the help of a mediator, you can find a solution. Mediators are volunteer professionals who can help you resolve issues without the high cost of legal fees.
Wonder if he's single.
Hey, I saw him first.
Call us or reach out on the web if you'd like to volunteer or donate.
Experience Highway's Performance Space and Gallery.
I knew my journey would lead me to a place
where I'd find a highway that I could travel to the beat of my own drum. Ride out the storm, 95 Joey died, but deadly was born. And there would be no limits to the vibrancy of my performance.
Join us each week at Highway's Performance Space and Gallery and live without limits. Log on to highwaysperformance.org.
Welcome back, everyone. Our guest today is Dr. Shamsa Mercy, an OBGYN and fertility specialist here in Santa Monica. Dr. Mercy has been in practice for more than 12 years. She sees women of all age groups and counsels her patients on prevention as well as making regular exams a priority for their continued good health. Hi, Dr. Mercy, and thank you for joining us today on our show, Candid Conversations. It's really something great that you do. You see women from all walks of life at every different age in their lifetime, and I think that's so important. And I wanted you to touch on that a little bit.
I feel so privileged to do what I do because I see patients starting as early as 13 or 14 years old through their dating life in their 20s, and then in their 30s when they're ready to think about having a family and starting to expand their life and going through pregnancy, delivering their babies, and then going through the very tenuous cycles of perimenopause and menopause and all the hormone changes that accompany that. And then finally going through the transition period of menopause and postmenopause, which can be very challenging for many women as they enter that part of their life.
Wow.
That's true. At what age? Every year it changes what age you should start going in for different tests and exams. What is the right age for a woman to start going in to have her female exams?
So definitely when a woman starts menstruating, and if she's having difficulty with menstruation, heavy periods, painful periods, they should come in just to start the conversations about how to manage that. As women go through their teenage years and early sexual reproductive years, thinking about Gardasil vaccines and HPV vaccines, that's important for mothers to have their daughters come in and start talking to their doctors about birth control, safe sex, and also protection against HPV. And then starting at age 21, regardless of whether you're sexually active or not, a woman should be seen every year for their annual checkup, which includes a detailed breast examination, a pelvic examination, a pap smear, and then testing for different ailments.
21.
21.
Wow. Okay,
Wow.
Good to know.
Well, I want to ask you when menopause starts.
So the average age of menopause is 52, and menopause is defined as no periods for 12 months. But what's interesting is many women start having difficulty with estrogen and hormone imbalance as early as their 40s, early 40s. So starting at 40 onwards, many of my patients will come in and they'll be expressing symptoms of hormone imbalance, whether it's irregular periods, mood changes, sexual dysfunction, loss of libido, even simple things like fatigue, depression, memory changes. Those could all be signs and symptoms of estrogen and hormone imbalance.
Well, for me, I actually was told, because I had all of those symptoms at age 37.
Oh, and that can
So
happen.
I had early menopause, and I was like, okay, what's going on with my body? What's really going on?
But it's something that women don't tend to talk about as much.
No.
We talk about things as you're younger, you talk about certainly birth control, and there's certain things that women will talk about. But when it comes to menopause, that's it. Everybody's just super quiet. They don't want to discuss it. They don't want to talk about it. They don't want to discuss their symptoms. Why is that?
Well, I think the word menopause itself is very daunting for most women because it represents aging. And that's how people think about it. I've had patients come into my office and I diagnose them as menopause based on their symptoms and blood tests. And they literally shed tears because they're so sad about ending a reproductive part of their life. And what I approach it with my patients is you're just transitioning through different cycles in your life. Even from your 20s to your 30s to your 40s, our bodies are constantly changing. And so as you go through your changes, instead of struggling and keeping things to yourself, go to your doctor and discuss all the different symptoms, including sex, including libido, including your mood. Don't just assume it's stress. Don't assume that you're not getting enough sleep. But talk to your doctor, because for each of the symptoms, there's actually solutions that are very manageable and that can completely change the quality of your life.
Okay. When you're talking about menopause, then, you hear different things about hormone replacement, take it, don't take it. What is the current findings? What do you think?
So hormone therapy is not without risks. When patients come to me and they ask me for management of menopause, what I tell patients is you have to look at yourself as an individual. So you can't go to a doctor and have a doctor write your prescription. That would be the wrong way to start. What I tell patients when they first come in and see me is let's start off with simple things like lifestyle changes. So working on exercise, good eating habits, getting plenty of sleep, changing your entire lifestyle so you can be as healthy as possible. And then approaching also your diet in terms of supplements, so things like vitamin D, omega-3, and natural ways of replacing some of the hormone imbalances. Patients who have estrogen deficiency, they can naturally replace their estrogen through things like soy, black cohosh, herbs, acupuncture, trying things first before prescription. The interesting thing about hormone therapy is that it's not without risks. So before we used to tell patients, if you're in menopause, take hormones. But now with all the studies, we're finding out that hormones actually can increase your risk of breast cancer, can increase your risk of heart disease, and that's not the first choice for patients. Many patients also start thinking about bioidentical hormones. There's a big phase about that, bioidentical hormones. And they come
Is there a difference?
There is a difference in that the synthetic hormones are made from pregnant horses' urine.
Okay.
So patients don't obviously like the idea of taking that. But bioidentical hormones are still hormones. And what's important about patients to recognize is that they still have risks. So if you're if your doctors are prescribing bioidentical hormones, you still need to be seen every year. You still need to be evaluated for bleeding and making sure that the hormones are not causing risk factors, including uterine cancer. The good thing about bioidentical hormones is that they're made to really represent the same type of hormones that your body was naturally producing before you went through menopause. So it mimics what your body was doing before you started having symptoms, which means it's much more well tolerated with less side effects.
See, I actually went into the black cohosh for myself because when I studied up on the hormone replacement, I said, wait a minute, what's that little part at the end that says cancer? No.
Yeah, that's a little scary.
No. So I went for the black cohosh, and it actually worked out fine.
It does. Black cohosh, primrose oil, soy products, they work. And even we're finding that medications like SSRIs, which are used for depression, those can also have a role with for improvement of hot flashes.
Wow.
So I recommend that for many of my patients.
Oh my goodness.
So now, when you counsel your patients and they come in for their annual exams and things like that, what if a woman comes in with certain symptoms? Let's say there's symptoms that may not be directly related, like if there's back pain or something out of the ordinary. Do you recognize those things as being something else or something more important to look at?
I think for every woman, if you know your body and if you feel like something is different, you should not ignore it. You should go to your doctor and find out what's wrong. Many times women are dismissed. They're told it's stress, you need to get some sleep, you need to go work out a little bit, lose a few pounds. Don't be dismissed. If you find your doctor's dismissing you, it's time to find another doctor. What I try to do with my patients is I work in a team approach. So I tell patients, your entire health is based on mind, body, and spirit. So definitely we have to look at stress and lifestyle choices, but then also looking at the body, because as women, our body works like an orchestra. All the hormones have to work well together. Thyroid, your skin hormones, your sex hormones, your estrogen, your testosterone. And then there also are true medical conditions that can mimic menopause. So instead of just assuming it's a hormonal imbalance, you have to first rule out true medical problems, whether it's diabetes, thyroid disorder, a pelvic mass, things that could mimic some of the causes of back pain that could be simply ignored or brushed off as stress or back pain from working out too much.
Right, and I think the big thing now, of course, is discussing the BRCA gene and the BRCA1 and the BRCA2 gene, which many women have much concern about doing, testing for breast cancer, especially if it runs in your family. How concerned should we be about that?
Well, breast cancer screening is integral for every woman. So starting at age 21, when patients come in for their pap smears, I review with them how to examine their breasts. Because most of the time when women are diagnosed with breast cancer, it's actually a mass that they find or their partners find. Starting at age 40, every woman should undergo a mammogram, at least every 1 year. And then starting at age 50, obviously a mammogram every year. The BRCA test has come to great publicity because of Angelina Jolie and all the media focus on that. And it is a true condition that patients should explore with their doctors, especially if they fall into certain criteria. So if you have 2 family members diagnosed with breast cancer and they're diagnosed less than age 50, if there's a family history of ovarian cancer, colon cancer, that's something that you need to discuss with your doctor about, are you a good candidate for the BRCA test, and would the insurance be something that you could qualify for?
Okay, that's good. Now, the important thing is you have to be proactive. You have to arm yourself with lots of information. I mean, that's really crucial.
You have to be proactive. Every woman who's watching the show and every woman here, including us, needs to be proactive. So you need to go to your doctor. And the key thing is not going when something's wrong, because that's what all of us do. We wait until something doesn't feel right, and then we go in, we put it off because we have so many other people we're taking care of. But going in for prevention, and that's what I try to really focus on with my patients. If you work on preventative health, so things like not smoking, exercising, eating healthy, managing your weight. Most women gain 1 pound every single year. By the time they're in their 50s and 60s, they already have multiple medications on board for diabetes, thyroid disease, high blood pressure. Women focus so much on hormones, but the #1 leading cause of death in women after the age of 50 is actually heart disease. And so women don't think about themselves as having risk factors for heart disease, but we have to all pay attention to that.
Dr. Shamsha, you've given us so much great information today. As women, we can all benefit from that. And I think the important thing we have to look at is being proactive.
Absolutely.
And certainly taking care of ourselves so we can take care of everybody else.
Yes.
So our thanks to Dr. Amersi for coming on our show today and
Thank you for
discussing these
having me.
important
Thank you for joining
points
us.
and some important things about women's health care. We're going to be right back after this message with our next guest, Dr. Farron Amersi. Stay with us.
I thought I was all thumbs. Turns out they're green.
It feels good to focus on others.
My tax preparation skills are appreciated, and I don't have to wear a tie.
Nothing beats a great hand except lending one. Be a wise volunteer. Support seniors in maintaining balanced lives. Visit wiseandhealthyaging.org or call 310-394-9871.
Hey, slow down!
Right next to the library on 7th Street is the Santa Monica History Museum, where history comes to life for the entire family. Enjoy the exhibits, main gallery, the photo archive, research gallery, and much more. Come visit the Santa Monica History Museum, keeping history alive.
As a woman, chances are the words breast cancer make you pay close attention when news and information about the topic comes up. It can be even more concerning when you are facing a breast cancer diagnosis. You may have questions and be confused by what you hear, and you're definitely not alone. Today, we're going to take a closer look at breast cancer, the advances in treatments, and the research that continues to better understand and outsmart this perilous disease affecting so many women today. Our guest is Dr. Farron Amersi, breast surgical oncologist and assistant professor of surgery at the Saul and Joyce Brandman Breast Center at Cedars-Sinai Hospital. Thank you so much, Dr. Amersi, for joining us today on our show. You know, the words breast cancer would scare anybody, and I know it's a very disheartening thing to hear when you get that diagnosis. What would you tell women when that comes in? I mean, what is the first thing you say to a patient?
The great part about breast cancer today in the year 2000 is that breast cancer, the chances of survival is extremely great. More women who are diagnosed with early stage breast cancer have over a 90% survival.
That's good.
Oh, wow.
So the key is really early detection.
Okay.
They always tell us as we're young to self-examine, either in bed, in the shower. Is that always the best thing to do? Is that always supposed to be the first step?
So we recommend doing breast exams, self-breast examination, starting at the age of 20. We also recommend that every 3 years, starting at the age of 20, that your doctor does the breast exam. So this could be your internist, a gynecologist, does a good breast exam on you every 1 to 3 years. Starting at the age of 40, we recommend, that's where the guidelines are, where women should be getting yearly mammograms. So that's starting at the age of 40. In addition, they should be having a breast exam done by a clinician, and that could be your internist, your family doctor, your gynecologist should be doing a yearly breast exam. But monthly breast exams are very important. I think it's important, especially for women who are premenopausal under the age of 50, to really get comfortable with knowing what their breasts feel like, especially with variations in the menstrual cycle where your breasts can feel lumpier than normal.
So you have mammograms, but what is the other exam for women that don't like mammograms? I know there's another way to actually do that without using that type of machine?
Great. So mammograms actually are really the best way for early detection of breast cancer. Some women say that they've heard that ultrasounds can be a good way to diagnose because they don't hurt. Ultrasounds, you just lie down and somebody uses a machine over your breast. The bad part about screening ultrasounds is they're not good they don't have a good sensitivity at finding things because it's very dependent on the person who's doing the procedure. In the next several months, most hospitals are going to be getting automated breast ultrasounds where it's a machine that's put over your breast that does about 1,500 images of your breast and can really detect small lesions. But really, what we do recommend is still getting a yearly mammogram because early breast cancer, which we call stage 0 breast cancer, presents as calcifications on a mammogram, and that can't be picked up on an ultrasound.
Wow.
So really, even though women can get breast ultrasounds, mammograms are still the best way for early detection.
What does dense breast mean?
Right. Dense breasts mean dense breasts are usually women get dense breasts when they're on hormone replacement therapy, and women who are premenopausal.
Okay.
Dense breasts, when you look at a mammogram, the mammogram looks like there's a white cloud over the breast, so it becomes harder to actually detect lesions that might be tumors that are behind that white cloud.
Wow.
So that's why we've had women where they've had a mammogram 6 months ago that was apparently normal, and then suddenly you feel a large breast mass and you look back on the mammogram and the mammogram still looks completely normal.
Wow.
So it's especially young women that we're seeing that, where we see dense breasts. So women where they're actually still menstruating or women on hormone replacement therapy can have density on their mammograms. It's actually a law now in California for every woman that gets a mammogram and you do have density on your mammogram that's noted, they actually get a letter letting them know that they're at increased risk for breast cancer now.
Wow.
So it's a law that was just passed in February of this year in the state of California.
Oh my goodness. It's really good.
Well, I think it's really important and it'll save a lot of lives too. I think women
Absolutely.
will pay more close attention to that. And I think it's important that we talk a little bit about things that are in the news now with the BRCA genes, the BRCA1 and the BRCA2 genes, and the history of breast cancer in a family. How does that affect women?
So there's been a lot of attention towards BRCA 1 and 2 mutations. What's important for everyone to know is more than 80% to 90% of breast cancer today is still what we call sporadic, where women have no family history.
Okay.
It's really only about 7 to 10% of women that really carry the genetic mutation for BRCA 1 and 2. So people that really should be tested for the mutation are any woman diagnosed with breast cancer under the age of 50, regardless of family history, meets criteria for testing. If you have no family history, if you're not affected by breast cancer, you need 2 relatives, and these are first-degree relatives. So that's mother, sister, grandmother that's diagnosed with breast cancer, and at least one should be under the age of 50. Male breast cancer, if you have a family history of breast and ovarian cancer, because being BRCA 1 and 2 positive puts you at risk also of ovarian cancer.
Okay.
And then women who are of Ashkenazi Jewish ancestry, because 1 in 40 Ashkenazi Jewish women carry the gene.
Wow.
Every day we get new research. I was reading about a certain place in China where women there, no one in this certain village has ever heard of breast cancer, and they attribute it to their diet, their steady work, their sleeping habits. So obviously you don't have to get breast cancer. So what can we do on a daily basis with our eating and our exercise to really lessen our chances of getting it?
So the one thing that we do know that has been linked to breast cancer is obesity. And there isn't a specific diet, but it's really obesity in and of itself that is linked to breast cancer. In addition, alcohol. So drinking more than 2 glasses of wine a day has been linked to breast cancer as well. Exercise is very important. There have been many studies that have shown that women who exercise routinely have been shown to have a decreased incidence of breast cancer. So those are really the most important things. There's not really specific things in diets that have really been identified that prevent breast cancer or reduce your risk of breast
What
cancer.
about environmental concerns? A lot of people talk about that too.
Sure.
Are there environmental concerns that we as women should be more aware of?
There haven't been
that affect you for breast cancer.
Sure. There are other cancers that have been linked to environmental carcinogens.
Okay.
Breast cancer has not been.
Okay.
It is one
Well, that's
cancer
good to
that
know.
hasn't been shown to be linked to the environment as of yet.
How do you, since women have mammograms for men, like for instance, Montel Williams, who he had breast cancer. So how did they diagnose that?
Sure.
Without a mammogram?
So men actually present with the lump in their breast because they really have very little breast tissue. The breast tissue is really behind the nipple, so men really don't obviously need to get mammograms. But most men who get diagnosed with breast cancer will present with a painless lump in their breast.
Oh,
That's actually the first sign, is really a painless lump in a man or a woman's breast.
Wow.
Is it always a needle biopsy to way to detect if it is breast cancer?
So if it's picked up on a breast exam, then yes, that's the best way. And most women come in and say, you know, I don't want the needle biopsy. I'm concerned that it may spread the cancer. I just want it out.
Right.
What's important to know is that the needle biopsy can give you a lot of information up front and helps us in terms of management of breast cancer as well. It saves a woman having to go through 2 surgeries because the biopsy may be benign, not cancer. And the woman may have gone through unnecessary surgery that she may have not needed.
Right.
So getting the biopsy first is really the best way, and then you can really have a conversation with the woman about whether a lumpectomy is a good option or mastectomy, what the differences are.
Right.
So
What
a woman
are the
can make a good
differences
choice.
between that? When do you have to be more aggressive?
So really, women who present with large breast cancers, women who have a strong family history of breast cancer, women who carry the BRCA mutation, where we recommend having bilateral mastectomies, because if you do carry the gene and you're diagnosed with breast cancer, your risk of a second breast cancer, a brand new breast cancer, so not the same cancer coming back in 5 years, is 20 to 30%.
Wow.
So that's why most women, if they're diagnosed with breast cancer, carry the gene, end up undergoing bilateral mastectomies. There really hasn't been any data showing a survival difference between a lumpectomy and a mastectomy. And we've now been doing lumpectomies for over 30 years. But there is a higher incidence of recurrence if you have a lumpectomy.
I think the important thing that we want to stress to women is that if you find a lump, it isn't always cancer.
Absolutely.
Be proactive, as we were talking about before. Pay attention to the warning signs. Be attention to, making sure that you take care of it. Don't let it go.
Correct.
I think that's what we want to stress here. But
just go to your doctor.
Absolutely. Well, thank you so very much.
You're welcome. Thank you for having
so
me.
much. Great
Thank
information.
you for joining us.
Thank you.
I'd like to take this opportunity to thank both of our guests today, Dr. Shamsa Mercy and also Dr. Farina Mercy, for being on our show and sharing their medical advice, as well as providing more information on women's health care, as well as breast cancer and its treatments. Remember, putting yourself first and staying current on annual exams, along with paying attention to the changes in your body, is a reality check and essential for your long-term good health. Don't wait. Be proactive, as we said, and take charge of your health care. With some of the advice provided on today's program, you can better understand the importance of focusing on you, as well as being confident in control of your good health. On behalf of my co-hosts, Becky Lantry and Dina Diamond, I'm Sandra Seapack. Thank you so much for being with us on Candid Conversations.